Good day. I'm Dr. John Bruchalski. I run an OBGYN practice. I take care of women of all varieties in Northern Virginia. I'm coming to you guys today to talk about the real important issue of abortion. The challenges as well as the blessings of caring for people in that environment. I'm here today to talk a little bit about my conversion because I've been on both sides of this issue. I aborted children for 2 years of my life. We also now run a practice that puts our actions where our mouth is. As James talks about, you need to kind of do what you believe in, or else you don't really believe in it. And then thirdly, I'll take a few questions from the audience, and let's get started. So folks, I want to break this conversation up into 3 parts. One is my story, since I've been on both sides of this issue. The second part is to talk about what I'm doing now, what we're doing now here in Northern Virginia to provide real service and health care to women. And then thirdly, to answer some questions that we've got from you guys in the audience, okay? So my story. So for 2 years, I aborted babies. I believed that it was a need that women had to eliminate a pregnancy that they didn't want. I thought it was healthy. I thought it was medically sound. And I started out doing little ones, the ones that are about an inch big, really soft, no bones. You use a suction machine back then to do that. While I was a resident during those 2 years, I also gave medicine to women to have this done, the medical abortions. I also accompanied a lady while she aborted her child around her toilet. This is what happened to me. So I believed it was something good, something necessary. So I started off with the little ones. And it took me about 10 years to get the guts up enough to do it, because it is a brutal, challenging, difficult procedure. Now I go around to medical schools and I challenge my pro-choice students, hey, if you believe it's so good, go ahead and do it. Just like I did, go ahead and try. Locally at one of the medical schools, 2 years after my first talk, I went back for a second talk, and many of these women had the same experience I had. They couldn't do it anymore. Let me tell you about this. So you start off believing it's really good for women. It's their right. Come on, it's just a blob of cells, right? Well, you start off doing the little ones. They teach you in a papaya. We poke a hole, you do it, you try to practice on a piece of fruit. Not quite the same thing. You remove the fetus and then you have to count body parts. You got to make sure the uterus is empty and that you didn't poke a hole in it, because the uterus, the womb, is something that really wants to hold on to a baby. It's not built to have something sharp or something powerful placed inside of it. Well, as you go along, the 6-week, 1-inch baby becomes a 12-week, 2 to 3-inch baby, and they begin to have bones. And then the mom who's scared, the woman who's scared, comes to you at 14 weeks, 15 weeks, and they fit in the palm of your hand. They fight back. Remember, I'm only about 6 to 8 inches away from destroying that life, because that's what you're here for. Abortion is getting rid of a pregnancy. Well, it's really a child, a fetus. It's your child, your fetus. And over time, as you do bigger and bigger ones, it begins to affect you. Sad, angry, bitter. Why are they getting into this mess in the first place? The damn boyfriend doesn't love them. They're being used. Over and over and over again. One of my last abortions I did was a 4-pound baby. The mother didn't want it because it was slightly defective. So I induced labor, pulled the child out by the feet, and then poked a hole in the back of its head to remove its cranium, its brains. That's the reality of abortion. You know, people say, oh, there's not enough abortionists out there. That's right. Nobody wants to do this. Very few people raise their hand, right, and say, hey, when I grow up, I want to be an abortionist. The pain that these women are in, I'm with you. I'm tracking here, folks. I believe in empowering women and treating them with dignity. Please, this is not about a woman's right. This is about what happens in the procedure. While this was going on, I began to read article after article after article. Preterm labor rises when you damage the cervix. That's a baby who delivers way early. You begin to see breast cancer rising with abortion. When you remove the pregnancy, the baby, those hormones drop cataclysmically, and the woman's breast that's learning how to make milk for the baby kind of gets trapped in no man's land, no woman's land. And those cells are more at risk for becoming to developing breast cancer. How many people do you listen to on your iPods? How many people do you know on TV who got breast cancer at a very early age? The aggressive type. The number one and number two reasons for those early aggressive breast cancers, and this is data from all over the world, is hormones being taken for more than 2 years before your first pregnancy, often found in birth control pills, or 2, aborting your first pregnancy. Those are the risk factors. And yet we don't want to talk about it because abortion is a political issue as much as it is a medical issue. So here I am wanting to be the best female doctor I could be, the best OBGYN. So here I was scientifically learning the data. Abortion is not as easy as people say it is. To do them is pretty brutal. In fact, it's kind of grisly business. That's why there are so few of us who do it. But I still stuck it out because I wanted to provide that service, right? And then thirdly, I kind of remember what my mom and dad used to tell me when I was little about how Jesus loves all of us and how our church teaches that you can take care of people who have the least, as well as support life from beginning to end. We'll talk about that in the question and answers. So, during this cathartic process, a wonderful doctor encouraged me to really think about this and to pray about this, even though at this point I didn't believe in anything. She just simply said, I know you're having a hard time, give it some thought, give it some prayer. Within a short period of time, I know it's hard for you to believe, I heard the Mother of God, Mary, speak to me to say to me that what the path I was on was not only not healthy for myself, but for my patients, and that there was a much better way to go. I blew her off the first time. She said, why are you hurting me? I heard it distinctly, clearly, life-changing. I said, no. 2 years later, while I was doing terminations, I heard her again directly speak to me. Johnny, there's a much better way. Care for the least daily. Be the best doctor you can be. And follow the teachings of my son's church. I wasn't a Catholic at the time. It was as if scales came off my eyes, and I began to pray and read. I then realized that one of my best friends was a guy by the name of Bernard Nathanson. Do you know he was one of the top first 3 abortion providers who got it legalized in New York State in 1968. He became a friend of mine because I was following in his path. He wrote an article in the New England Journal of Medicine somewhere in the early 70s where he was doing an ultrasound during an abortion, and he saw what he was doing. He was a secular Jewish man, no faith, but he saw scientifically what he was doing. He created a movie about this called The Silent Scream. I challenge you, look it up. It is unsettling because this issue is unsettling. This is not like Dr. Pimple Popper on the HG channel, right? This is not a blob of cells, which we're going to talk about in a minute. So I had this radical change, and I knew that I had to see the underserved, provide real social justice, as well as be pro-life. You had to do both, because if you don't honor life at its beginning or at its end, it doesn't matter what else you believe in. Housing the homeless, clothing the naked, all that kind of goes out the window because your foundation of respecting human life, right? It does. What about black fetuses? Why are black women, African American women, aborted at 3 times the rate? Why do they have 3 times the rate of preterm birth? Because 70% of all clinics are in their neighborhood. The founder of Planned Parenthood was a eugenic racist, bigot. I know because I worked there. This is a real challenge here. And then you've got to do, right? Just like when I was pro-choice, I had to do abortions. When I'm pro-life, you got to do something different. So now let me tell you about what we're doing now. We run Tepeyac OBGYN up in Fairfax, Virginia. It's open to everyone. So Tepeyac OBGYN is the medical practice. It's not for profit. We don't own it. We work alongside Divine Mercy Care, which is our group that not only raises money, but raises awareness. Why? Because we beg for money to take care of people who are underserved. We don't believe in pushing them aside. We want to give them real options, real alternatives to abortion. Whether it's adoption, whether it's keeping the child, whether it's maternal services, whether it's building their life after their boyfriend leaves them. We work with pregnancy centers all throughout the region. We've actually raised money for pregnancy centers all over the country. So one is we put our money where our mouth is, and we go after those who have nothing to show them that there's a better way. Because remember, most moms don't want abortion. They really don't. Number 2 is we see all women here, all different strata, all different financial backgrounds, all different faith backgrounds, because all are welcomed here. We also run a perinatal hospice where if the baby is so sick, we use your womb as a hospice to care for those children. We'll talk about a little bit more of that, I think, in the question and answers. We also provide excellent hormonal and surgical and medical care for all the women who come here. Why? Because that's what medicine is really about. We also provide spiritual support. We work with all the churches in the area. We have been so greatly supported by the Catholic Charities of the Arlington Diocese. Women who are worried about where are they going to get their next meal, they send those patients here because they think they have to have an abortion. We listen, we walk with, we accompany. There's no judgment here. We tell people what the risks and benefits of the procedure are. We engage them, but we can't go to the abortion with them. most of us here have been in that business. And the destruction and the brutality, the sadness, the depression, the anxiety on the patient's end, we just don't talk about it. We see all these famous people telling us to do it. Yeah, right. So that's what we're doing today. I'd love to open it up to some questions right now. Either questions about what we do or part of the conversion, or some medical questions from the virtual audience here.
Okay, so the first question is, how do we know life begins at conception? We've heard about it being just a clump of cells. Can you explain that?
Yeah, so the question's about how do we know life begins at fertilization when the sperm and egg come together? Well, have you or your mom or your dad or your cousins or your aunts or your uncles, have any of you done 23andMe? Have any of you done Ancestry, finding out where you came from? Have you ever done the medical ones where they can tell you what your diabetic risk is, what your hypertensive risk is? That test is accurate at the 1-cell stage. It is as predictive as if you were doing it at the age of 30. And if that doesn't convince you that life begins at that moment, from a genetics point of view, it's a unique individual human being at that moment, a human life. And that's why it needs respect.
We've heard a lot about rape and incest, and the woman doesn't want to keep the baby because it's a reflection of the horror and violence that was done to her.
So, once again, folks, I know you guys are asking these questions. I asked all these questions, and I did abortion for rape and incest. But what I realized from a patient, and I'll tell you her story in a minute, is that when you are brutalized physically, intimately, repulsively, are you going to turn around and do the same repulsive, destructive, brutal act to a child that may have been conceived? Think about it. Are you going to brutalize that person because you were brutalized? I don't think that's what common sense, I don't think that's what psychology says is the best idea. Let me give you an example. One day in my residency, I saw a 38-year-old African-American woman come in labor. I asked her, wow, how old are you? She said 38. I said, well, how many babies is this for you? She says, well, it's been 11 pregnancies. I said, well, how many kids, have you had vaginal births? She says, I've never borne them. I aborted 5 out of boredom, but I was raped 5 times, and I aborted them. This was the 6th rape. Something I woke up with one day, and I said, oh my God, I can't do this again. I kept turning my back on these lives. This one I'm going to keep. I said, well, where do you live? She said, San Diego. We were in Norfolk, Virginia. Psychologically, she drove across country, she showed up, and she safely delivered a child that she quickly then gave up for adoption. And she said, after all those years of being caught with the only option of getting rid of life, she felt for the first time in her life that she was doing something positive with her experience. And she felt so badly that it took her all those tries before that. So I want to tell you that, once again, just because you were brutalized doesn't mean that you then go ahead, turn around and brutalize another innocent person. Next question.
Yeah, Dr. Bruchalski, we've heard a lot about the life of the mother when it's in danger. Can you explain that?
Yeah, so let me just give you my story. Blue Betty walks into the clinic, and she had a heart defect. Blue because her face was blue. She wasn't getting enough oxygen. And so we quickly took her to the operating room, where we had to do the abortion because the pregnancy was jeopardizing her heart, getting enough oxygen to her lungs, getting enough blood to her lungs. Both mom and baby died in the operating room at our hands. The baby was about 1.5 pounds. We were breaking it apart. The woman threw a pulmonary embolus. When we did our overview of that case, the data said we should have put the woman in the intensive care unit and taken care of her, optimized her, took a good history. The baby could have survived with a delivery rather than what we did. So the operative way to think through this is you care for both patients, mom and baby, and you get them as far along as humanly possible. Then you don't make the woman guilty that she took her life over her child. Because most of these moms who are sick like this, they don't want an abortion, but they're scared for their own life. And as a doctor, I don't say, oh yeah, the kid's life doesn't mean anything. Let's just end it and it'll save your life. No, you try to care for both. And we have great medicine today. Medicine is improved so much that whether it's lupus or heart disease or cancer, we get both mom and baby as far along as possible so they both can make it. That's the reality. You never pit one woman against one child, ever. It's not psychologically good. Because even after the woman lives and the baby is now aborted, she will feel guilty, as most of my patients have, the ones that I did back in residency. Anything else?
Yeah, follow up to that. So if the woman had some kind of cancer, like you said, or something, and she was at risk, would you deliver the baby early?
Oh, yeah. So, there are many, many strategies to optimize the chemotherapy or the radiation or the surgery. We've had some uteruses, cervical cancers, that we've had to remove the baby in the uterus, deliver the baby, and then do the hysterectomy, which is taking out the woman's uterus. So yes, it's very common to be able to get the baby as far along as possible, then do the proper care for both mom and baby, and then take care of the mom's cancer.
Okay, that makes sense. What about in a situation where we know the baby's going to die either in utero or after the baby's born? Why should the woman have to carry that baby to term?
So the question is, if a baby is so sick that it's going to die soon after we clamp the cord, why would you not just deliver the baby as soon as possible? Well, believe it or not, folks, most of your mothers want to spend time with you when you're sick. Imagine a new mom with a baby that's loved and wanted, that is happened to found to be very sick. You don't naturally kill very sick people. You just don't do it. You maximize the time, and now we use perinatal hospice or hospice principles. That's when you keep the patient who's sick as comfortable as possible as the disease completes that life, kills that patient. But I can tell you that I've done them both ways. I've had significant sick babies that we aborted in residency right away. The mother never saw those children. Just take them out of the room. I don't want to see this. I was backed into a corner. This is horrible. When you begin to engage the mom on a hospice level, when that baby is born, it's held to the woman's chest and she cries the tears of a loving mother. The father is there as a loving father. They know that they kept their baby as long as possible. You deliver the baby and allow nature to take its course. And I have found over 35 years of practice that the perinatal hospice, hospicing a baby when it's so sick inside the womb of its mom, is a wonderful, healthy, difficult, but very positive approach to caring for a sick sibling, a sick child. Remember, the child is sick. It's not defective. Many of my friends, I have several cousins who have Down syndrome. Before my change, I thought Down syndrome children were just a waste. And my cousin Mike, who was my age, kept asking me if he was an endangered species. People with disabilities or illnesses are just like you and I. I don't know how many young people have genetic illnesses. I have to tell you, it's amazing. You can learn a lot from someone who is not as healthy as you think they should be, or what their life is like. It's really a radical difference.
What about the woman who feels it's her body, so she should be allowed to do what she wants with it?
Yeah, that's if there wasn't another body inside of hers. Think about this, folks. Systemic racism. This problem that on your farm back in the 1860s, you had another body that you considered your property. Think about what the slogan, "My body, my choice" is. My farm, my choice. My body, my choice. You're literally making another human person, another body with its own chromosomes and its own illnesses and its own future. All it needs is protection and food to grow. And then it eventually will change its address and come outside of the mom, out into your life. How different is it from back in the 1860s saying that these African Americans were not people, they were property. That's what that slogan really means, my body, my choice. You hear every day at Mass, and I want to challenge you guys to think about it, even if you're not interested in being there. This is my body given up for you. Do this in remembrance of me. The world says, my body, my choice. They said that about African Americans. They said that about Jews in Europe during the 1940s, during World War II. We can do whatever we want with them. It's my body, it's my country, it's my farm. And once again, the church comes back and says, Jesus comes back and says, this is my body given up for you. Do this in remembrance of me. Right? Total difference. If you really want to be countercultural, kind of follow what Christ's talking about. That's why you give up. That's why we have a nonprofit company. That's why you go out of your way to see the least of your brothers and sisters. That's why you believe in racial equality. Right? Come on, it's my body, my choice. I remember I bought into it. But once that is true, then you have to abort the 7-pound baby a week before delivery if she asks for it. Right? Abortion on demand. Do you know there's only 2 or 3 countries in the world that do that? North Korea, China, America. Abortion on demand. That's where we are today, folks. Europe, South America, they don't do it. They have legalized abortion up to X amount of weeks. That's how they try to handle it. But we believe in abortion on demand. Why? Because it's my body, my choice. It's ridiculous. It's another body. And that body happens to be human. We've made this mistake over and over and over and over again. We're still making the mistake today.
Yeah, Dr. Bruchalski, why focus on abortion and euthanasia when there are many more important issues like racism and poverty and caring for the poor mothers who already have so many babies to care for?
The reality is might makes right in politics, folks. And if you don't get it right at the beginning, the right to life, everything else will begin to, well, only these people will deserve housing. Only these people deserve health care. Only these people, you just pick and choose. Might makes right. And the foundation of a right to life, liberty, and the pursuit of happiness makes plenty of sense. Common sense, medical sense, and I also believe political sense.
Yeah, what is the earliest viability for the baby in the womb? How many weeks?
So the question was asked about viability in the womb. When I'm 60, and I guess I was 29 or 30 when I had my change of heart. Back then, we could save 24 to 25 to 27 week babies, just depending on what was available. Today, we're down to 22 to 23 week babies. That's where viability. What that means is that the baby can live with medical help because the lungs will work and we can begin to care for all the parts of the baby. So with improved science, as everybody says, follow the science. Well, we're just doing much better medicine these days. That's why we can take care of sick moms and don't have to abort the baby to save the mom in most cases. That's the reason why we can save earlier and earlier pregnancies. It's also realizing that just because your skin's a different color, you're all part of the human family. Just because you're sick means you're still part of the human family. Just because you're small and 1 inch big or 1 cell big, but your genetics fit, you're just part of the human family. That's the key here, folks. It's family. Not only do we talk about it in the Our Father, but scientifically and genetically, we're part of the human family. Simple as that. Let's care for our brothers and sisters.
And one last question, Dr. Bruchalski. Can you explain how the pill is an abortifacient?
So, yeah, sure. Birth control pill is a combination of 2 hormones given to women to try to prevent pregnancy. It's an estrogen and it's a progesterone. Those are the 2 dominant hormones in women's bodies. And so by giving you high doses of those medicines, 3 things happen. One is it tries to prevent ovulation, but because the doses of the estrogen got so high, they caused cancer, which we didn't talk about earlier back in history. And we've had to lower the dose, and when you lower the dose, you get escape ovulations. And we knew that. The second method is that the progesterone thickens the garage door's mucus, meaning the sperm can't get up into the uterus to conceive a pregnancy from the egg. So the sperm get blocked, but not perfectly. The third mechanism, which is what leads to early abortions or can lead to early abortions, is that these 2 hormones screw up the lining of the uterus. Now, the lining of the uterus, the womb, is where the baby implants. I'm not going to get into a technical lesson here, but it's usually thick and it's ready to try to implant a little baby, an embryo, that's trying to bury itself to grow. Remember, babies need blood supply. They get it from the mom's uterus. Well, those hormones, the estrogen and the progesterone, especially the progesterone, makes that lining dry, thickened, hard. So rather than implanting, it can't burrow into the lining and it falls out. You don't know how often that happens, maybe 1 in a million. But if you have 60 million women on the pill, that's a lot. That's 60 a month. So that's how we think about it. That's one of the reasons. These are not perfect. We don't take our pills every day. All that leads to irregular cycles, irregular bleeding, and sometimes an early abortion. Well, I just want to end this. I want to thank you so much for listening. This is not an easy topic to listen to, no matter what side you're on. First thing, I want to challenge you. If you guys really have questions and you want to carry this more than just a soundbite, I want you to contact divinemercycare.org. That's divinemercycare, all spelled out, .org. Give us your questions, and if you're not just pulling our leg, we will get back with you, and we'll do our best to answer any question you have, either on the medicine, the science, or even on the faith. Because not only is it good science, but it's good love. It's about family. That's the first thing. Number two is, if you really want to see what the life movement is like, I'd love you to volunteer at divinemercycare.org. You can contact us. For all of you out in the audience who want to be abortionists and want to murder babies, go ahead and do it. Try it. I did. I couldn't do it. It hardens your heart. It quickens your pulse. It makes you question everything about human life. And that's somebody who wanted to do this, who wanted to care for women. So go work at a pregnancy center. Volunteer your time once a week. Do the baby bottle drives. Work for Catholic charities and see what we do on a daily basis. Or contact us at Divine Mercy Care. We'd be more than happy. So the first thing is that send us your questions. Number two is volunteer even if you don't believe it. See what it's really like. Don't just leave it here, bring it into here. Move it those 18 inches, okay? And then thirdly, look around you. If you believe that you can solve problems by getting rid of a baby in the womb of their mother, and somehow that's good policy, that's good medicine, that's good psychology, come on. Sadly, I spent so many years of my life on one side of this. I didn't see that in my patients. It was kind of profit. It was what I did. Somebody had to do it. And I realized, wait a second, no. We need, as a community, we need to come together and care for those women and those broken people in those relationships. Nobody enters a relationship and goes, hey man, get me pregnant so I can have an abortion. It's always what we think is the least worst option. The depression, the anxiety, the substance abuse, the suicide. The data is out there and it's in spades. It's not a healthy choice. Women deserve better. Think about it. Think about it. Think about the songs that you listen to. Think about it. The pain. The fleeting good feeling. Does it last? I don't think so. I think you have an opportunity to be really countercultural, folks. Look into this. Think about your faith. What are the things more important than Christ? Music, job, money, fun? Think about it. You don't have to be, it can be just a normal part of your life. Because I can tell you that the peace that I found back when I was with my parents very early in my life and then now is beyond description. And I want to share that same peace with you. So I want to challenge you, be really countercultural. You don't have to brag about your faith. You can just live it. And I encourage you to do so. Thank you so much for your time. Many blessings. Stay healthy with the virus. And God bless and take care.